All right, get ready to dive into some ancient Chinese medicine with us today.
Sounds exciting.
We're going way back to the Yellow Emperor's Classic of Internal Medicine, specifically Chapter 39, which you chose, all about blood vessels, or lua.
That's right.
Now, this isn't just like a basic anatomy lesson, though. We're going to uncover some pretty surprising insights from back then about these vessels and how they were understood.
And how they were treated, too. It's pretty fascinating.
What I find really interesting is that the text itself is structured as a dialogue between the Yellow Emperor and his physician, Qi Bo.
Yeah.
It's like we're listening in on a medical conversation from centuries ago.
Yeah, like a fly on the wall in the Yellow Emperor's court.
Okay, so let's break down this luo concept first. It says here they're described as separate from the main meridians.
Right.
So not just any vein or artery, then.
Oh, not at all.
What makes them unique, especially in the context of Chinese medicine?
You can think of Luo as this network of smaller pathways that branch off from those main meridians. It's like they're the side streets and alleys of the body's energy transportation system.
Oh, I like that.
Essential, you know?
But often overlooked.
Yeah, often overlooked.
Interesting.
Yeah.
So they're kind of playing this supporting role, but with their own distinct functions. That already kind of challenges some of my assumptions about how blood flow was viewed back then.
Absolutely.
Then, to make things even more interesting, the Yellow Emperor throws Qi Bo a real curveball. He describes all these unusual patient reactions that he's seen after needling these blood vessels.
Yeah, he does.
Oh, I remember this part. Collapsing, blood gushing out, even like the blood itself looking different. Not exactly the results you'd want
Not ideal, no.
from a treatment. Right.
Right.
Was this like common back then, or was the Yellow Emperor just cherry picking the most extreme cases here?
Well, it's really hard to say for sure, you know? But I think the point that he's trying to make is to illustrate just how important it is to understand the nuances of Luo and how they're connected to Qi.
It's a key, the body's vital energy.
Yeah, exactly.
Because if you don't, there can be consequences.
Definitely, yeah.
But what I appreciate is that Qi Bo doesn't just dismiss these cases.
No, he doesn't.
He gives a specific explanation for each one.
He does.
It's like a masterclass in ancient diagnostics.
It really is, yeah.
Like, take the collapsing patient, for example. Qi Bo links this to a deficiency in both blood and Qi, made worse by the needling itself. It seems to really highlight the need to assess the patient's overall energetic state before you even try to manipulate these delicate pathways.
Absolutely. You can't just go in there and start sticking needles in without a good understanding of what's going on.
Right, so it's not like a one-size-fits-all approach.
No, not at all.
You can't just stick needles in willy-nilly.
Precisely. You got to know what you're doing.
Another example is that scenario where the blood gushes out forcefully. You might think, oh, this person's got robust health.
Right.
But Qi Bo says no. He attributes it to an overabundance of blood and Qi, particularly an excess of yin Qi,
Right.
which throws off the body's balance.
Exactly. Too much of a good thing can be bad, you know?
Yeah, and that yin and yang dance, right.
Always. Yeah.
It seems that balance, or lack thereof, is really key to understanding how they viewed health and illness.
Oh, absolutely. Yeah, it's fundamental.
And even the appearance of the blood itself provides clues.
It does, yeah.
Dark, turbid blood
Mhm.
suggests stagnant yang qi, while blood mixed with a clear fluid means recently consumed fluids haven't been fully integrated yet. They're like decoding a secret language,
It is like that.
written in blood and qi.
It is, yeah.
Now, I was particularly struck by the idea that needling could actually cause swelling.
Oh, right.
Isn't that the opposite of what acupuncture is supposed to do?
It is, you would think, right.
Hmm.
It is a little counterintuitive from a modern perspective. But Qi Bo says this is like a buildup of water or yin qi concentrating in areas where yang energy dominates. Again, it comes back to that delicate balance we were talking about, and how even a seemingly beneficial intervention can backfire if it's not applied correctly.
So with all this in mind, how did they even decide where to needle in the first place? Was it just based on like these visual observations of the luo, or were there other diagnostic methods involved?
That is a great question, and it leads us to one of the most fascinating parts of this chapter, Qi Bo's specific instructions on examining these blood vessels.
Okay.
He advises practitioners to look for specific things like firmness, tension, redness, and even variations in size.
Wait, they were assessing the size of these luo?
They were.
Some as thin as a needle, others as thick as a cord, and then they did all this without any fancy imaging technology.
That's right. They were relying on careful observation and palpation.
Wow,
skills that were passed down through generations.
that's amazing.
What's remarkable is that some of these observations, like redness and swelling, still indicate problems today.
So even though they didn't have the same scientific vocabulary that we do, they were still onto something real.
They were, absolutely.
That's pretty mind-blowing. So once they made their diagnosis, what did they actually do with that knowledge? How did they go about treating imbalances in this Lua system?
Well, Jibo emphasizes regulating any surplus or deficiency through needling. So it's not just about sticking a needle into any random blood vessel, but really understanding which specific areas are out of balance and using targeted techniques to try to restore harmony.
Okay. So far, we've covered those unusual reactions to needling and the importance of careful assessment. But there's one more mystery that I gotta ask about, this phenomenon of the flesh sticking to the needle after insertion.
Yeah,
Sounds almost supernatural.
right.
What did Chibo say about that?
He actually had a very down-to-earth explanation for it. He attributed it to heat. He said that when heat builds up within the body and travels through the needle, it causes the surrounding flesh to stick to it.
Wait, so the needle's getting hot enough to make the flesh stick? Did they have, like, some kind of ancient heating element that we don't know about?
No. He's talking about internal heat, the kind generated by imbalances in the body's energy.
Okay.
Think about it like this. If you have inflammation in your shoulder, the area feels warm to the touch, right? He's saying that this internal heat can be transmitted through the needle, causing the tissue to stick.
Wow, that's a really fascinating way to think about the connection between energy, heat, and physical changes in the body.
It is, isn't it?
It makes you wonder, what else did they observe that we're just now beginning to understand through the lens of modern science?
It really does make you wonder. And that's a perfect lead-in to the next part of our discussion, where we're going to go even deeper into Chibo's diagnostic and treatment methods. And I think you'll be surprised by some of the techniques he describes.
All right, I'm ready. Let's continue our exploration. Okay, so we've learned that needling the lure can have some unexpected side effects,
Excellent.
and that careful observation is crucial.
Yeah.
You don't want to end up in one of those sticky situations.
Literally.
Literally.
Yeah.
But let's get specific here. What were some of Chibo's go-to techniques for regulating these blood vessels and restoring balance?
Well, this is where things get really interesting. He outlined several different approaches, and I think some of them might surprise you.
Okay, I'm intrigued.
For example, he talks about using moxibustion.
Moxibustion.
Yeah, it's the burning of mugwort.
Right.
As a way to apply heat to specific points along the luo.
Hold on. So we've gone from needles that can get hot on their own to intentionally applying even more heat.
Right?
Wouldn't that make things worse if, heat's already an issue?
It does seem kind of counterintuitive, I know.
Yeah.
But the idea is to use heat in a very strategic way. Think of it like using a controlled burn to clear out underbrush. In this case, the heat from moxibustion is thought to stimulate circulation, clear any stagnation, and restore the flow of qi and blood.
Okay, I'm starting to see how this fits into their whole system,
Mm-hmm.
even if it doesn't necessarily align with Western medicine.
Yeah, it's a different way of thinking about things, for sure.
So did they have any other techniques besides needling and moxibustion?
Oh, absolutely. Kibo also mentions using topical applications,
Topical application.
like herbal poultices and compresses.
Interesting.
And these were often made with very specific ingredients tailored to the condition being addressed.
Oh, okay.
So, for instance, a poultice with warming herbs might be used for a luo blockage caused by cold, while a cooling compress could be used to help reduce swelling and inflammation.
So they had like a whole pharmacy of natural remedies to work with.
They did, yeah.
It sounds like they were taking a very holistic approach,
Sure.
thinking about not just the lua themselves, but the entire energetic landscape of the body.
Exactly. It's all connected, you see.
And it's important to remember that these treatments weren't just seen as like isolated interventions.
Mhm.
They were often combined with lifestyle recommendations,
Oh, yeah, for sure.
like dietary changes and exercises, such as Qigong,
Yeah,
to really promote overall well-being.
exactly.
It's like they were weaving together all these different threads to create a truly personalized approach to healing.
Very much so.
But let's go back to those needling techniques for a minute. We've talked about how important it is to really assess the luo before treatment,
Mm-hmm.
but how did they actually manipulate the needles once they were inserted? Was it just a matter of sticking them in and leaving them alone?
No, not at all.
Yeah.
Kibo describes a variety of techniques, and each one has its own specific purpose.
Okay.
For example, he mentions a technique called tonification,
Conification.
where the needle is rotated and manipulated in a way that's thought to boost the flow of qi and blood.
Oh, so they weren't just passively inserting these needles, they were really actively using them to influence the energy within the luo.
Precisely. They were very hands-on.
And there's also a technique called sedation,
Yes,
which aimed to reduce excess or stagnation
that's right.
by using a different set of needle manipulations.
Yeah, subtle but important differences.
It sounds like they had a whole language of needling techniques,
Mhm.
each with its own subtle nuance.
Absolutely.
So did Chibo say when to use which technique? Did they have like a decision tree or some set of guidelines?
You're right. These techniques definitely weren't just applied randomly.
Yeah.
Kibo really stresses that the choice of which technique to use depends on the individual patient's presentation, the nature of the imbalance, and the desired outcome.
Oh, okay.
So he gives specific examples like using tenosification for a deficiency of qi and blood and sedation for an excess or a blockage.
It's like they were already practicing what we call personalized medicine today,
That's a great way to put it.
tailoring their treatments to the unique needs of each person.
That's a key takeaway from this chapter,
Yeah.
for sure.
Uh,
Even though they had a totally different set of tools and theories, they were already thinking about the human body as this complex system,
Right.
and that there was no one-size-fits-all solution.
It makes you wonder how much of their wisdom we've lost over time, and how much we could rediscover if we looked beyond our modern assumptions.
It's a humbling thought, isn't it?
It is.
And it really emphasizes just how important it is to stay open to different perspectives and approaches, even those that seem strange or unfamiliar at first glance.
Okay, I'm ready to push my understanding even further.
Right.
What else did Chibo reveal about these mysteries of the Luo?
Well, he goes on to discuss a fascinating phenomenon known as collateral circulation,
Collateral circulation.
where the blood vessels create alternative pathways to bypass any blockages.
Wait a minute, they were talking about collateral circulation back then? I thought that was a pretty modern concept.
It is, yeah, a relatively modern idea in Western medicine.
It seems like these ancient practitioners had a remarkably advanced understanding of the body. They knew how it adapts and compensates.
They did, yeah. Chibo talks about how, in certain conditions, blood can spill over from the main meridians into these collateral branches, which creates new routes for circulation.
So the Luo weren't just like static pathways, they were dynamic
Yeah,
and responsive to changes in the body's internal environment.
that's right.
That's pretty ahead of its time.
It is, and what's even more intriguing is how they connected this idea of collateral circulation to the treatment of certain conditions.
Oh, okay. How so?
Well, for example, Chibo mentions using needling techniques to encourage blood flow into those collateral channels in cases where a main meridian was blocked or injured.
Oh, I see.
So they were essentially trying to stimulate the body's own natural healing mechanisms,
Yeah.
guiding the flow of blood and qi to restore balance.
Wow. It's really amazing how much they were able to figure out
It is.
without the technology we have today.
It really highlights another key principle of their whole medical philosophy.
What's that?
Working with the body's innate intelligence rather than trying to force it to do something.
That's a powerful idea.
It is, isn't it?
This whole conversation has really made me rethink my assumptions about the history of medicine.
Me too.
It's clear that these ancient practitioners were much more sophisticated than we often give them credit for.
And it makes you wonder, what insights could we gain from their wisdom today?
That's something I'll definitely be thinking about.
Mm-hmm.
But before we get too lost in the thought, I have a feeling there's even more to discover in this chapter.
Oh, absolutely.
What other treasures are hidden in these ancient texts?
Well, there's a section coming up that delves into the relationship between the low and the internal organs.
Okay.
And it's pretty fascinating stuff.
Lead the way. I'm ready to see how they connected these seemingly different parts of the body. So we've seen how the low are much more than just passive channels for blood.
Right.
They're dynamic and responsive
Yeah.
and super interconnected with the body's energy. But this next part is where it gets really mind-boggling for me. Chibo starts talking about the luo being linked to the internal organs. How did they even come up with that connection?
This is a perfect example of their holistic way of thinking.
Okay.
They didn't see the body as just a bunch of separate parts, but as one big integrated system.
Right.
With everything influencing everything else.
So the luo weren't just about circulation then. They
No.
were like energetic bridges between the organs.
Exactly. Kibo explains how each major organ has its own corresponding luo vessel that acts as a pathway for qi and blood to flow to and from that organ.
Okay, I'm trying to picture this. So if someone had a problem with their liver, for example,
Mm-hmm.
They might also see signs of imbalance in the liver's corresponding luo.
That's right.
It's like they had this whole map of energetic connections, allowing them to diagnose and treat conditions in a way that seems, I don't know, way ahead of their time.
It is pretty remarkable.
So, do they give us any specific examples of how these organ luo connections actually played out?
Oh, absolutely. Chibo gives a bunch of examples.
Like what?
Some of them are very specific. He says, for instance, that a blockage in the lungs luoi vessel could show up as chest pain,
Okay.
shortness of breath, or even skin problems.
Hold on. Skin problems. How did they link something like that to the lungs?
They observed that the lungs luo vessel had branches that reached out to the skin, especially in the upper body.
Hmm.
So they thought that if something was off balance in the lung, it could disrupt the flow of qi and blood to the skin, and that could cause all sorts of skin issues.
Wow, that is a level of detail that I'm having trouble even imagining.
I know, it's pretty amazing.
But it makes you wonder, were they right? I mean, do those connections actually hold up when you look at them from, a modern scientific point of view?
That's the million-dollar question, right? It's a bit of a mixed bag, to be honest. Some of what they saw, like that lung-skin connection, has been sort of validated by research today. Yeah. We know now that there are some pretty complex relationships between our organ systems and our skin health.
So even though they might have explained things differently back then, based on what they knew,
Right.
they were still onto something.
Exactly. And that's what makes these old texts so fascinating. They remind us that there are different ways to understand the body.
Yeah.
And even these seemingly outdated models can still have some truth to them.
Okay, what other organ luo connections did they talk about?
Well, Chibo also talks about the heart's luo vessel,
Okay.
and they believed it played a part in regulating emotions and even sleep.
Really?
Yeah. They noticed that if there were disturbances in this vessel, it could lead to anxiety, insomnia, and even like heart palpitations.
So they're making a connection between the physical network of blood vessels and, the less tangible world of emotions and our mental state.
That's right. They were acknowledging that the mind and body are deeply intertwined
They were way ahead of their time.
in so many
It
ways.
makes you wonder what other insights we might find in their wisdom,
It does, yeah.
if we're just willing to keep an open mind.
Absolutely.
But before we go too far down that rabbit hole, I want to bring it back to our listeners.
Okay.
What does all this mean for us today? Why should we even care about these ancient concepts?
That's a good question. I think there are a few important takeaways.
Okay.
First, it's a good reminder that our bodies are these incredibly integrated systems where each part affects the whole.
Hmm.
Second, it shows how crucial it is to look beyond just our symptoms, to try and understand what's really causing those imbalances.
Okay.
And finally, it challenges us to consider the role of subtle energies like kind when we think about health and disease.
It's like we've been given this brand new lens
Yeah,
to view the body through
Right.
one that lets us see connections and patterns that we might not have noticed before.
that's the power of exploring these ancient traditions. They give us new perspectives, different ways of knowing, and that can help us understand ourselves and the world around us better.
Well, you've definitely sparked my curiosity. I'm ready to learn even more about this ancient wisdom.
That's great to hear.
I have a feeling this is just the beginning of my journey into the world of Chinese medicine.
That's probably true.
And to our listeners, I hope you've enjoyed this deep dive as much as I have.
Me too.
What parts of this exploration stood out to you? What questions are you still thinking about? It's amazing to think how these ancient ideas might still be relevant in our modern world, giving us insights into the intricate workings of our bodies and minds. Thanks for joining us on this deep dive, and until next time, keep exploring.